Hello, this is Khurram Nasir and you're watching Optometry with Khurram, and this is our third video. This is our third lecture regarding the E-metropization. In the last lecture, we have discussed about the hypermetropia, right? We have discussed about the clinical features, we have discussed about the classifications in terms of hypermetropia, and we have discussed about the prescription guidelines in hypermetropia in a certain age groups, like from newly born to 1, 1 to 3, 3 to 6, and 6 to onward of the age groups. And the learning outcomes of this video, of this lecture, are we will discuss about the classifications of myopia, right? And we will discuss about the clinical features like the signs and the symptoms in myopia, and we will also discuss, which is actually the crux of this video, we will discuss about the prescription guidelines in myopia in a certain age group, like from newly born to 1 year of age group, from 1 year to 3 years of age group, from 3 years to 6 years of age group, and from 6 years to onward of the age groups. So let's discuss about the classification first. So we have three different categories in myopia, like we have low myopia, we have moderate myopia, and we have a high myopia, right? So what is actually the low myopia? If the value of the myopia is from 0 to 2 diopters, this is called the low myopia. And if we have the value of myopia is from 2 to 6 diopter, this is called moderate myopia. And if the value of myopia is more than 6 diopter, that is called high myopia, right? I hope this is clear. And now let's learn about the clinical features, the signs and the symptoms in myopia. So first of all, we will discuss about the signs. So in myopia, the length of the eyeball, the axial length of the eyeball will be greater than the normal, right? So the normal axial length in adults is 24 millimeter. You know very well that. So in myopia, the axial length will be more than the normal, right? And after that, the size of the pupil in myopia is larger than the normal, right? And the anterior chamber depth, the depth of the anterior chamber or the depth of AC anterior chamber is more than the normal. Why? Because in myopia we know very well that the axial length is more than the normal, right? So in this case, if the axial length in myopia is more than the normal, it means that the structures inside the eyeball are away from each other, right? They are apart from each other inside the eyeball. So it means if the axial length is greater than the normal, is more than the normal, then iris is more away from the cornea, right? So that's why the depth of the anterior chamber will be more than the normal, right? So more than, if we discuss about the fundus, if we examine the fundus in myopia or in high myopia, so the peripheral retina, right, will be more weaker than the central retina. And we will examine the myopic crescent, a half moon crescent at the margins of the optic disc, right? So these are some sort of signs in myopia. And now we will discuss about the different complaints or different symptoms in myopia. So in myopia, the patient will face the complaints at distance and near complaints. So the distance complaint will be more as compared to the near, right? So why it is happening that patient will face more difficulties at distance? Because the light rays in myopia, the light rays are not focusing on the retina, but they are focusing in front of the retina, and power of the eyeball is more than the normal. So when there is more power than the normal, the light rays will converge in front of the retina and it will make a blurred image on the retina, right? So that's the reason that in myopic patient, the distance vision will be blurred, right? And in case of near vision, you know that the higher the myopia, the higher the plus power inside the eyeball, the nearest will be the far point. So in myopia, the far point will be closer to the eye, so there will be a minimum complaints in near vision in myopic patient, right? And now we will discuss about the further complaints in myopic patient. The myopic patient will squeeze his eye, he will squint his eyes to make the things clearer. So this is another sign in myopia. And in school going children, there will be a complaint of low performance in school work or in studies, right? And the myopic patient or the myopic child will be the introvert. he will more confident in indoor activities as compared to the outdoor activities. And now we will discuss about the prescription guidelines in different age groups. So first of all, we'll discuss about the infancy age from 0 to 1 years of age, right? And in this age, from newly born to 1 year of age group, there is no any need to prescribe any prescription in this age if the myopia is low to moderate. Remember this. If the age is from newly born to 1 year and myopia is from low to moderate myopia, we know very well about the values of low myopia. From low myopia is up to 2 and moderate myopia is up to 6. So if there is myopia from 1 to 6 diopters, there is no any need to prescribe any glasses, right, in this age group from newly born to 1 year of age group, right? So you do not need to prescribe any prescription, any aid, any optical aid in this age group from 0 to 1 year if the prescription is from 1 diopter to 6 diopters. There is isometropic myopia. So our patient is myopic, but which myopic? Type of myopia is isometropic, right? Iso means same. So patient is myopic but isometropic myopic, right? It means that the patient got the same refraction in the both eyes. For example, if the patient is if the prescription of the patient is less than 5 diopters, less than -5 diopters in both eyes. For example, patient got -2 in right eye and -2 in left eye, there is no need to prescribe any glasses. If the patient's prescription is -3 in right eye, -3 in left eye, there is no need to prescribe glasses, right? If patients got -4 in right eye, -4 in left eye, there is no need to prescribe any glasses. But if the prescription is more than 5 diopters, like the prescription is -5 in right eye and -5 in left eye, then we'll prescribe prescription, but reduced prescription. How much? We can prescribe 1 to 2 diopters. 1 to 2 diopters in right eye or 1 or 2 diopters in the left eye. So the crux of this portion is if patient's age is from 0 to 1 years and patient is myopic. Which myopic? Isometropic, right? And if the prescription in both eyes is less than 5, then we will not prescribe any glasses. But if the patient's prescription is more than 5 diopters, then we will prescribe the glasses, but reduced prescription, right? If patient, for example, if patient got -7 here and -7 here, then we'll prescribe a reduced prescription up to, you can say, -3 here and -3 here, right? So now we will discuss about the anisometropia. So now the patient's age is 0 to 1 years, from newly born to 1 year. Patient is myopic but anisometropic. Anisometropic, right? So if the anisometropia, you know very well, anisometropia is difference of refraction in the both eyes, right? So if the anisometropic value is less than 2.5, there is no need to prescribe, right, in 0 to 1 years of age. Again, I repeat, if anisometropia is less than 2.5, there is no any need to prescribe any aid, any optical aid, right, any optical assistance. So if the anisometropia is more than 2.5 diopters, if anisometropia is more than 2.5 diopters, then we will prescribe a reduced prescription to prevent any deviation, to prevent any amblyopia, right? Again, I repeat, if patient is myopic, and which myopic? Anisometropic, right? And patient's age is 0 to 1 year, and if anisometropia is less than 2.5, there is no need to prescribe. And if anisometropia is more than 2.5, if anisometropia is -3, if the anisometropic value is -4, -5, -6, then we will prescribe the prescription, but reduced prescription. Why we will prescribe? To prevent any deviation or to prevent any amblyopia. And now we will discuss a different age group. Now we will discuss about from 1 year to 3 years of age group, right? And for example, If the patient's age is 1 to 3 years of age and patient is myopic, you do not need to prescribe any glasses if there is a low myopia. What does it mean? If myopia is of 0 to 2 diopters, there is no need to prescribe any glasses. But you will correct the high myopia or moderate myopia. If myopic value is more than 2, right, then you will prescribe a reduced prescription in the patient's eye, right? So now we will discuss about the isometropic and anisometropic conditions in this age group. So for example, if patient is myopic but isometropic, right? So for example, if isometropia means same refraction in both eyes, if isometropic value is less than 4, less than -4, if isometropia is less than -4, then there is no need to correct this myopia, right? But if isometropic value is more than -4 or -5 or -6 or -7, right, then we will prescribe the glasses. And how much we will prescribe the reduced prescription. For example, if patient got -7 in this eye, in the right eye, and -7 in the left eye, then we will prescribe the glasses. We will prescribe the glasses, but we will not fully correct that patient, right? We will prescribe glasses to prevent from amblyopia. We will prescribe if we have -7 in right and -7 in left. So this is isometropic value, same correction in the both eyes, but we will prescribe up to -3.5 or 4 in the left eye and the same in the fellow eye. And now we will discuss about the anisometropia. So if patient's age is from 1 to 3 years old and patient is myopic, and which myopia? Anisometropic. And if anisometropia is less than 2.5, anisometropia is less than 2.5. Remember, this is an important point. I'm not talking about the prescription itself. I'm talking about the anisometropia. If the difference in refraction is less than 2.5, then we will not prescribe any glasses, right? So if the difference in refraction is 2.5, then we will not correct. And if the prescription if the anisometropia or the difference in refraction is more than 2.5, if the difference in refraction is more than 2.5, then we will prescribe the correction to prevent any amblyopia condition. And remember, this is important. This is another important point. If there is any association of deviation, then what will we do? If there is iso deviation associated with myopia, then we will prescribe minimum minus. Remember this. If there is iso deviation associated with myopia, then we will prescribe minimum minus, right? If we required -2, we will prescribe -1.5 or -1.75, right? And if there is association of exotropia associated with myopia, then we will prescribe maximum minus. For example, if we required -2, we will prescribe -2, full correction, right? So if there is any associated deviation with myopia, in case of isotropia, we will prescribe minimum minus. And in other cases, in terms of exotropia, we will prescribe maximum minus. And now we will discuss about another age group, and that is from 3 to 6 years of age group. So our patient is myopic and patient is isometropic. The refraction is same in the both eyes. And remember, if patient's age is from 3 to 6 years, patient is myopic and isometropic, right? For example, in this case, if isometropia is the isometropic value is less than 3 diopters, in both eyes. If difference in refraction is, if the isometropia is less than 3 diopters, right? So it means that we will not going to prescribe, we will not going to correct any myopia in this case, if isometropia is less than 3 diopters. But if the isometropic value is more than 3 diopters, more than -3 diopters, then for example it could be -4 or -5 or -6, 7, 8 and so on. So if the isometropic value is more than 3 diopters, then we will correct. For example, if the isometropic value in the right eye is -6 and in the left eye is the same -6, right? So it is more than the -3 diopters, so we will prescribe. But how much? We will prescribe a reduced prescription, right? And how much? If it is -6, then we can prescribe -3 or -2.75, or same in the fellow eye, right? So this is the method to prescribe in isometropia in terms of myopic patient in age group of 3 to 6 years of age group. And now we will discuss about the anisometropia. So patient's age is 3 to 6 years, patient is myopic with anisometropia. So remember, if anisometropia is less than 2 diopters, right? So and if anisometropia, if difference in refraction in both eyes is -2 diopters, then there is no need to prescribe any glasses in this case. But if anisometropia is more than 2 diopters, then we will prescribe the glasses, right? For example, in the right eye we have -3, and in the left eye we have you can say 7. So it is almost the difference is almost more than the 3 diopters, right? So we will prescribe the glasses, but we will prescribe a reduced or partial correction in this case, partial or reduced correction. We can prescribe in the right eye got -3, so we can prescribe -1 here, and left eye got -7, so we can prescribe -3 here, or -3.5 or 4 here. So these prescriptions are reduced prescription. And why we are prescribing? To prevent the patients from amblyopia, right? And if patient is myopic and association is with amblyopia, right? Again, I repeat, if the patient is myopic with the association of amblyopia, then we will prescribe 2/3 of the prescription, right? Again, for example, this is important. For example, patient is myopic and there is association of amblyopia as well. Patient is myopic as well as amblyopic. So in this case, we will prescribe 2/3 of the prescription. And what is 2/3 of the prescription? For example, if the prescription in the right eye is -5 and left eye got the same -5, so we can prescribe the 2/3 of the prescription, and that could be -4 or -3.5. In which case, if myopia is associated with amblyopia. And now we will discuss about the school going age group, which is 6 years, proper 6 years of age group, 6 years or more than that, and patient is myopic. Remember that in this age, because the emetropization age, we have completed the emetropization age, we are actually nearest to the emetropization age. The emetropization will be fulfilled at the specific age of 7 years. So we are nearest to the emetropization age, right? So our patient's age is 6 years or more than 6 years, and patient is myopic. So in this specific age group, we will prescribe a appropriate and proper prescription of myopia. For example, patient is -2 in right eye and -3 in left eye. We will prescribe full correction in right eye and full correction in left eye. And now we will discuss some important guidelines in terms of myopia. Remember, we need to prescribe full correction if the patient is associated with amblyopia, if the patient is associated with squinting, or if patient is associated with the strabismus, We must avoid the full correction in myopia because it can cause the accommodative spasm. And there is only one condition in which we can prescribe the full correction or overcorrection actually, and that condition is the intermittent divergent squint. And if high myopia is there, then we will prescribe the undercorrection. So I hope you enjoyed all the contents in this video. So we have discussed about the different clinical features in myopia, and we have discussed about the prescription guidelines in myopia in a certain age groups. So we'll see you in the next video on emetropization.